Hi, I'm Dr. Miner. We've had a lot of clients ask about these PDO threads and how they're done. And so today we're going to demonstrate that. And I'm here with the client that we've already done some threads on. And we did some lifting threads, and we did them in a more vertical direction, along in this way, to help refine the jawline and lift this area. And now she would like some more to help tighten this area up a little more. And we are going to run the threads a little bit more in this angle so that they will pull this back and tighten that area. So today we're going to use lifting threads. And so these threads are actually surgical sutures, which as they break down, they get replaced with collagen. So with the lifting threads, it takes about 6 months for that thread to break down and get replaced with collagen. So initially, when the thread's placed, it holds the tissue, and then as it gets replaced with the collagen then holds the tissue in place. And so it's a natural way to build your own collagen. So with the lifting threads, they're going to last about 18 months, maybe 2 years, sometimes even longer. I've heard even reports of up to 3 years. And there's also what we call smooth threads, which they're a much smaller suture, and they last anywhere from 6 months to a year. So with lifting threads, the places we use those are in the facial area, the mid-face, what we call the mid-face, and we'll use that to refine the jawline, to lift the jowls, tighten in here with the fold area. And we also use those for the eyebrow lift, that we can raise the eyebrows with those, and also in the neck to tighten up the neck. Now the smooth threads, they can be used for areas that need a little refining and to help smooth out lines and wrinkles. So a typical place for that is around the lips with the vertical lip lines, the water bottle lines in there. Also in the 11s area where you get that crease, that helps to plump out that crease up between there. And even with the crow's feet to smooth out the lines that form there. And again, as they break down, they build collagen, and so you get your own collagen back. So this client wants to do a combination treatment. She wants to do some threads and some filler. And there's a sequence with this, and that is that the threads are first, and then filler follows. And then the reason for that is because the threads will move the tissue. And so as we move the tissue here, we want our filler to look as natural as possible. And so when the tissue is moved and we can place the filler right there, we'll get a more natural look rather than if we put the filler in first and then move the tissue, it might look like a blob. Alright, so we're about ready to get started, and the first thing we're going to do is use some anesthesia. And so we're going to numb this area down here with some anesthetic so it's very comfortable. Also with the lifting threads, the nice thing with that is that we can put a syringe of anesthetic on there. So if there's any discomfort, the client can let us know and we can put a little anesthetic right there and make this very comfortable. And it is non-surgical, which is the nice thing. There's no surgery involved with this. We just make some small holes where the needle goes in to place the thread, and that's it. Okay, so first thing we're going to do with this is I've drawn out where we want to place these threads. And I'm going to make an entry area right here with these threads, and I'm going to do that. I'm going to numb up this area with some anesthetic first. So we have a little pinch here. Okay, we're going to do some anesthetic. Got a little sting. Okay, so I'm just going to kind of take this needle into the direction we're going to go. And place just a little anesthetic there. And change direction, and we're going to go this way. This just gives when we do the thread, gives a little path to follow. Does that feel numb there? Does it need a little more?
A little bit more.
Okay.
Mm-hmm.
So that's the nice thing with this, is she can just tell me how it is. If she needs some more anesthetic, she just lets me know. Alright, so here's our thread, and I placed it on a syringe with the anesthetic. And so as we place this thread, if she needs some more anesthetic, she can just let me know, and we'll put some there. And so we're just going to take this into where we started that anesthetic. Okay, so we've made it up to right here. And so now what we're going to do is take out the needle. And there's a long thread in here, and we'll see some thread sticking out here. But I want to pull all of this back here, and as I do that, that's where I want the thread to hold that tissue. And so we can see the thread right there. And we can already see how it's holding right there. And we'll do our next one. And so now, with these threads, I can pull on them, and you can actually see the tissue move there. So they're engaging the tissue, pulling this back. And then we're just going to clip them. Oh, and that's it. And then we'll do the other side. Alright, so we got all done with the threads. Weren't really smooth from our standpoint. How was it for you?
Well, I have to say, it was it was a snap. It was a simple kind of thing. It was comfortable, and it didn't take very long at all. I was surprised what little amount of time it took.
Yeah. So this is one of those things you can come in over lunch, get it done, go right back to work. There's really not any downtime, and we can see the result right away. It's one of the nice things. And this will also get better. It's going to take a little bit of time, because as that thread breaks down and gets replaced with collagen, which that takes some time, we'll see this area smooth out a little more, tighten up just a little bit, and get a great result. And so now we are going to start with the filler. We're going to put some filler right in here to complete this. Alright, so we're ready to do the filler now, and we're going to use Voluma for this. And we're going to, her main concern is this fold in the tissue. And so what we're going to do is use the filler, the Voluma, to refine this area. And we have tightened this with the threads, and now we're going to fill this out and smooth this off with the Voluma and get a great outcome. Alright, so we got all done with the filler now. And how do you like it so far?
Well, for openers, I'm very comfortable right now, and I feel numb. So that part I'm really happy about. And the result, well, I have to say, it's kind of like someone lifted a veil off of my face. And I feel like a years were taken off of a calendar, and younger years were given back to me. That is what it feels like to me.
So did we accomplish what you envisioned?
Beyond and more. It was more than you've exceeded my expectations. Thank you. Thank you, I really appreciate that.
Yeah. And now that we're done, let's talk about some of the do's and don'ts. So we did a combination treatment, and with the threads, there's really not a lot you could say of post-operative care, except with, which goes for the filler as well, that you want to avoid alcohol, aspirin, ibuprofen, other things like that that cause bleeding and thin the blood, because that will create more bruising. And that's really the only reason. And although with filler, since we did filler, that has a little bit more post-treatment care. And with where we put it, you want to lie on your back when you sleep, right? So if you sleep on your side, the pillow can push the filler for about a day, and then it can distort where it's placed. So it's important to sleep on your back. You can do some light makeup. You don't really want to rub the area where the filler's placed, and it'll be great. Now, one of the final steps with the threads, which is optional, is to apply some tape, which we can tape the tissue so it stays back, and it just gives just lets the threads engage the tissue a little more, and you leave this on for a couple hours. And do you want to do that?
I'd like to do that very much. I think
Okay.
that's a great idea.
So we're just going to take a piece of tape.
How long does the tape stay on, Doctor?
You want to leave it on for about 3 to 4 hours at least. And so I'm going in front of our filler, and I'm going to get this and pull it back. We're going to stretch that. This is some stretchy tape. And we'll just do that. You can leave that on for a few hours, and we'll get a little bit better outcome than we already have.